Hi, my name's Nikki. I'm a children's occupational therapist, and I've been a children's occupational therapist for the last 26 years, specialising mainly in children with motor skill difficulties. I've been asked to briefly speak to you today about the signs that you might find or spot in children in your classroom or at home that may just trigger some warning signs that they may be dyspraxic. I think it's just really important to say that this list won't be exhaustive. There'll be many other signs that I won't mention or I won't have mentioned. And also that they need to have more than one area of difficulty really for dyspraxia to even be thought about. It needs to significantly impact on their daily life, and the signs need to really have been there from early on in childhood and throughout. So some of the signs that you may see may be in PE lessons or when you go to the park or on play equipment. They may seem quite hesitant in wanting to climb. They might not have the strength to climb. They might trip as they're running around. They might lack sort of hand-eye coordination in catching and throwing a ball, kicking a ball. And the spatial awareness to kind of kick a ball and negotiate around equipment and other children. They may appear quite fidgety in class. They may want to get up and move around quite a lot. They may lack sort of focus and attention on the subject or the activity they're doing, or they may flit around the classroom or at home quite a bit from activity to activity. They may not necessarily remember instructions that they're given. They may remember the first one, the last one, or none of them. And may sit in a little bit of a daze, wondering what they need to do or queuing into other children to see what they need to do. You might also at home send them off to get some socks or put their socks on. They may go upstairs or into their bedroom, and you may go 10-15 minutes later and find that they just sat on their bed reading or playing on their tablet or doing something else other than what you've asked them to do, and they really can't remember what they've been asked to do. They might struggle with focus and attention on the task they're doing. They might get halfway through, go into a little bit of a daydream or get distracted by noise in class, and then not realise what else they need to be doing. Other things that they might struggle with are handwriting, holding their pencil or their pen. It might look a bit awkward. They might complain of hand pain, finger pain, pain up their arm and their elbow. They might not be able to write very much, and they might keep putting their pen down, shaking out their hands, and then having to come back and write again. Their writing might be illegible. You might not be able to read it. It might not be sat on the words, might not be sat on the lines, or they might write away from the margins. Letter formation might be a little bit hit and miss, might be large, or it might be really, really tiny, and you can't read it. They may just struggle to get the amount down that they need, and the whole process might just look very effortful and tiring for them. You might see them rubbing their eyes, or complaining of headaches, or saying that the words just look a little bit funny on the page. When they're cutting out, they might struggle to cut out in a sort of a manner that flows. They might struggle to pick up the scissors and know what to do or coordinate the scissors and their paper, and that might look really hard work as well. So these are some of the things when it comes to dinner time, lunch times, meal times. They might struggle to pick up their knife and fork. They might not have the strength to cut or the coordination to hold a knife and a fork and use both together. They might just be happy to use their fingers and going really quickly with their fingers, or want to use a spoon as it's a lot easier for them. So these are some of the things that you might notice. Like I say, the list isn't exhaustive. What I've talked about isn't exhaustive. You might find issues with dressing, particularly when they're changing and then getting dressed again after PE. You might feel that they're putting clothes on back to front, shoes on the wrong way round. Fastenings might be really hard work for them, and they might spend minutes trying to put their buttons on, do their buttons up, and then give up. Or they might be the last one to get changed or dressed back again. Similarly, at home, you might notice that they're really struggling to dress themselves. Clothes might be on back to front, the wrong way around. Socks might be a massive issue, just coordinating getting them over the feet and having to strengthen their fingers to pull them up. So all sorts of things like this might give you some triggers or some red flags that potentially your child might have some form of motor skill difficulty. Like I say, if there's more than one of these going on and they really are struggling in all areas, for example, they're sort of more of their PE, gross motor skills, their walking looks a little bit off, or they're tripping a lot, their running looks slightly uncoordinated, and again, they're sort of stumbling and they can't keep going with it. They might not be able to sustain jumping. They might struggle with the coordination of skipping or hopping. And in their fine motor, like I said, there might be issues with very small manipulations, opening packets, so finger strength, hand strength, cutting, holding scissors, buttons, fastenings, those kind of things. And you might see those across the board in their lessons in school or at home time. And you might just find they're just getting so frustrated that it'd be worth perhaps having a think about pursuing some in further kind of assessment or investigations just to see what's going on. Sometimes it's just a case of they might just have traits or immaturities in some of these areas, and with the exercises that can be put into place, they can improve significantly. Or it may well be that across the board, in actual fact, they've got enough issues going on that dyspraxia is going to be the way forward and be diagnosed. Often the case or the route to diagnosis is going through a GP. As occupational therapists, we can carry out all the assessments that the GP or the paediatrician will need to sort of formally diagnose, but as occupational therapists, we cannot diagnose. So it's a case of taking the evidence provided by school and ourselves through to your GP, and then asking them to sort of refer you to a paediatrician, where they will look at all the evidence, see if there's any underlying medical condition that might explain some of the difficulties, and then offer that formal diagnosis. So like I say, it hasn't been an exhaustive list. It's just a few things to be aware of, a few things to look out for, and just know that the earlier you can get your children through or recognise these signs and symptoms, the better, because it's never too early to start working on these things, and it will help them no end come further along the line and into adulthood. So thank you very much for listening, and thank you for taking the time to watch this video.